Come on back.
Radiation treatment number 18 for me at Minnesota Oncology in Maplewood. After much thought, I chose this option, radiation, combined with the drug Lupron, over robotic surgery and other treatments for prostate cancer. Lupron turns off testosterone in men, which basically kills the cancer, but radiation is used to make sure it's gone both inside and outside the prostate. For me, 26 radiation treatments in all. Having been through cancer before, radiation is a relative breeze compared to chemo, but all treatments have side effects and prostate cancer treatment has its fair share. And most men actually choose treatment based on the side effects they can live with.
When you're talking about incontinence and erectile dysfunction, which are the two big ones that men come in for, that absolutely is in the calculus.
Meet my docs, urologist and surgeon Chris Knadler out of Metro Urology and radiation oncologist Warren McGuire. These guys get all the credit.
So, how am I doing?
You're doing great.
Am I?
Yeah, you're right on track and just about done.
Yeah. Did you say
Doing
the
very
same?
well, absolutely.
Yeah, and I think, Randy, you approach things the way that I would hope most patients approach them. I mean, first of all, you're proactive. As soon as you had any indication there was a problem, you got in and we made the diagnosis.
What's the most important thing that men need to know right now about prostate cancer?
There's no way to diagnose prostate cancer at a curable stage unless they get in and get seen and have a PSA and a rectal exam.
And a lot of times prostate cancer can be suggested just by that exam, rather than even a PSA. But the two of them together are very powerful and they really need to be done.
Both docs say tremendous progress has been made in prostate cancer treatment in the last 30 years. In the 1980s, 50% of men diagnosed with prostate cancer already had metastatic disease. Now that number is down to 5% at diagnosis. And the mortality rate for prostate cancer has decreased 42% in the last 25 years, most likely due to earlier diagnosis.
Let's bust some myths about this disease.
Sure.
Only older men get prostate cancer.
Yeah, absolutely not true. I one day operated on 4 guys in their 40s.
I see any number of men who are under 50 with prostate cancer, and it's a real struggle for them to decide how to go about treatment.
Sexual activity raises the risk of prostate cancer.
No.
There's some evidence that it may decrease the risk.
May decrease it. Prostate cancer treatment leads to impotence.
No, not necessarily. Obviously it can. In my case, you know, I'm primarily a surgeon, and we made tremendous strides with treating men and preserving sexual function.
And a lot of times their sexual function after surgery or radiation may not be as normal as it was prior, but there are also good treatments that can help improve that.
When we talk about myths about prostate cancer, I mean, one of the myths is you don't need to worry about prostate cancer. I mean, other than the lung cancer, it's the most common cancer men die of. So that's no myth, that's a hard fact.
Dr. McGuire says over half of his oncology patients have prostate cancer. And with the baby boomers entering age 70, that number could easily rise.
The demands on the healthcare system and then the incidence of this is increasing, there's no question about it. And we're not making any more urologists or radiation oncologists, I don't think at this point, but we're going to have more business.
Well, men should know one of the challenges in dealing with prostate cancer is deciding treatment, because there is a handful of choices. Great to have choices, but confusing at times because you do have options.